Bismillahirrahmanirrahim. This is the second part of the previous lecture that is related to the renal calculi, and in this lecture we will study the renal stone chemical analysis. Now, what is the importance of chemical examination of the renal stone? So, as we have discussed in the previous lecture, that stone formation is due to, in most of the cases, due to the supersaturation and very low or high pH. So it is a combination of both phenomena. So as the renal stone formation in most of the cases is dependent on these two factors, stone analysis will help in the treatment and prevention of reoccurrence in the patients. Now, what is the procedure of chemical analysis of the kidney stone? So first of all, urine is filtered by a kidney stone strainer after each time of urination and then stored in a clean, dry container. Care should be taken not to add any fluid including urine to the container, and do not apply tape or tissue to the stone to avoid any contamination. These are the reagents and their composition which are used for renal stone analysis. R1 contain hydrochloric acid, R2 contain sodium hydroxide, R3 sodium cyanide and sodium hydroxide. Reagent while 4 contain sodium nitrofreesite, R5 contain sulfuric acid and ammonium molybdate and ferric sulfate. The reaction while 6 contains sodium hydroxide and para-nitrophenyl urosinol. R7 contain potassium hydroxide and calcine. The reaction while 8 contain potassium iodide, mercury chloride. R9 contain acetic acid and neocoroprin and copper sulfate, and R10 contain manganese dioxide. So usually for stone analysis, two tests are performed. The first one is the flame test and the other is the qualitative chemical test. So in the flame test, immerse a metallic seeding loop into a distilled water, then into the calculus powder, bring to the flame. The carbonization or the disappearance of the powder is the sign that the components are mostly of organic origin. The absence of carbonization show that the calculus is of mineral origin. For qualitative chemical test, you have to take about 50 milligram of the calculus powder, transfer it into a tube and add 10 drops of the reagent R1, and effectiveness show the presence of carbonate. In this case, shake vigorously for mixture for 1 minute. The remaining mixture is called M1 in the table below. So this is the M1. Preparation of mixture 2. Mix 50 microliter of M1 and 5 ml of distilled water. Mix well and use for determination of calcium in step 5 in the table. So according to the steps below, dispense 1 drop, that is 50 microliter of the mixture M1 or M2 in each cavity of a ceramic cored plate or in tubes, and carry out the next 2 to 8 steps. So in the first step, we add 50 milligram of the calculus powder to the R1, and this is known as the M1 mixture. So if the effectiveness is visible and audible, the test is positive for carbonate. If it is negative, then this is negative for the carbonate. For the cysteine, we take this M1 1 drop and add R3 1 drop to this mixture, then mix and let it for 5 minutes and add the R4 1 drop. If red color appear, it indicate the presence of the cysteine in the sample. The test is positive for cysteine, and if the color is yellow, it will be negative for the cysteine. Similarly, for the phosphate determination, we take the M1 1 drop, and add R5 2 drops, that is 100 microliter, and mix and left for 5 minutes. If the blue color appears, it indicates the presence of the phosphate, otherwise the test is negative for phosphate. For magnesium, again we take 1 drop of the M1 and 1 drop of the R6, and then 5 drops of the R2, that is about 250 microliter. Mix the mixture and then check for the appearance of the blue precipitates. If the blue precipitates are there, then the test is positive for magnesium, otherwise it is negative. For calcium, take 1 drop of M2 and then add 1 drop of R2 and 2 drops of R7. Mix the whole contents. If the yellow color appears, the test is positive for calcium, otherwise it is negative. For ammonium salts, add 1 drop of the M1, 1 drop R2 and 1 drop of the R8 and mix. So organic brown precipitate, if it appears, then the test is positive for ammonium, otherwise it is negative. For uric acid, take 1 drop of M1, 1 drop of R2 and 1 drop of R9 and mix the whole contents. Yellow, brown or gray color indicate the positive results, otherwise the test is negative for uric acid. For oxalate, take M1 and add R10 with the use of the spatula, that is about 60 milligram. Wait for few seconds. If a fairness when visible audible sounds are produced, then the test is positive for oxalate, otherwise the test is negative. So this is the whole scheme of renal stone chemical analysis. Thank you for watching.